It is wonderful how exercise can boost our energy and well-being. But for anyone managing cystic fibrosis, or CF, knowing when to rest is just as important as knowing when to move. It is about tuning into your body and making smart choices that support your long-term health. People living with cystic fibrosis should generally avoid exercise during acute illness, especially with fevers, worsening lung symptoms, or significant chest congestion. This includes situations where you are experiencing a cystic fibrosis exacerbation or struggling with active infections, as pushing your body too hard can hinder recovery and worsen your condition. The primary reason to hold back on exercise during these times is to protect your body and allow it to prioritize healing. When you are ill, your immune system is working overtime to fight infection and inflammation. Exercise, while usually beneficial, adds an additional stressor to the body, diverting energy and resources away from this crucial healing process. Your body needs all its strength to combat the illness, not to recover from a workout. Moreover, intense physical activity can sometimes increase inflammation in the airways, potentially worsening lung function when it is already compromised. To decide if it is a good idea to exercise, first take your temperature. A fever of 100.4 degrees Fahrenheit or higher is a clear signal to rest. Also, pay close attention to your breathing. If you are experiencing increased shortness of breath, more coughing, or noticeable changes in your sputum color or amount, it is best to pause your routine. Listen to your body and look for other signs like unusual fatigue, chest pain, or feeling generally unwell. Consider reducing the intensity or duration of your workout if symptoms are mild, or opt for complete rest if they are more severe. Always communicate these changes with your cystic fibrosis care team. An interesting tip from cystic fibrosis experts is to consider the neck check rule. If your symptoms are above the neck and mild, like a runny nose or mild congestion without a fever, light exercise might be acceptable. However, if symptoms are below the neck, such as chest congestion, a deep cough, body aches, or if you have a fever, it is a clear sign to skip the workout and rest. This simple guideline can help you make a quick and informed decision, preventing unnecessary strain on your system during vulnerable times. Remember that consistent communication with your cystic fibrosis team is a vital part of making these decisions. Understanding when to hold back from exercise is not a setback. Instead, it is a proactive and smart strategy for managing cystic fibrosis. By giving your body the rest it needs during illness, you are supporting a faster recovery, preventing potential complications, and ultimately building a stronger, more resilient foundation for your long-term well-being. It is all about listening to your body and making choices that empower your health journey.